Kourtney Kardashian has recently opened up about her baby plans in a recent episode of Keeping Up with the Kardashians, in which she revealed she is contemplating freezing her eggs so she can expand her brood in the future if she wants to. The 38-year-old reality star already has Mason, 8, Penelope, 5, and Rain, 3 with her ex-boyfriend Scott Disick, who she dated on and off for almost 10 years. Until 2015, but is weighing up her options now she is in a relationship with boyfriend Younes Benjima. This news came shortly after Kim Kardashian West welcomed her third child into the world, and half-sister Kylie Jenner gave birth to her first baby. Kourtney said, "I don't know what I want. What if I want a kid in the next 10 years? Wouldn't you rather have the insurance? Like, sitting there? Okay." Online exclusively spoke to reproductive endocrinologist at Extend Fertility, Dr. Batsheva Maslow, about the fertility treatment. Here is everything you need to know about freezing your eggs. Cryopreservation is the technical name for egg freezing, enables women to free themselves of the pressures of their biological clock as fertility begins to decline around age 30. So women who freeze their eggs have the opportunity to tackle their life goals while increasing their chances of a healthy pregnancy later life. Egg freezing is the process of preserving a woman's eggs by retrieving some of them from her ovaries, freezing them, and storing them so they can be used if/when she decides to get pregnant at a later date. Eggs can be stored indefinitely as there is no scientific evidence that the health or viability of frozen eggs decreases over time. Numerous healthy babies have been born from eggs that have been frozen for 5 to 10 years, with the longest successful thaw coming after 14 years. There are many factors that contribute to the success rates of egg freezing. For example, how old a woman is when she freezes her eggs, how many eggs she freezes, what method of egg freezing is used and more. A patient undergoing cryopreservation will be assigned a personal fertility advisor to be on hand throughout the entire procedure. The actual egg freezing process typically entails 8 to 10 days of hormone injections to stimulate a woman's ovaries to produce multiple eggs, and 5 to 7 short office visits, which include blood tests and transvaginal ultrasound exams. The retrieval process is a 15-minute surgical procedure performed under mild anesthesia. The physician inserts a needle through the vaginal wall into each ovary to draw out the eggs and surrounding fluid. The eggs flow through the catheter into test tubes, which are then handed off to the embryologist, a highly trained expert in the science of oocyte cryopreservation, but there are no scars left or stitches involved. The actual anesthesia lasts for about 15 to 20 minutes, length of the retrieval process, and the immediate recovery to return to full consciousness lasts for about 1 hour following. Patients are advised to rest for the remainder of the day after the procedure, as they may suffer vaginal soreness and cramping, which is similar to period pain, and can last for a few days after the procedure. In general, any healthy woman who currently has at least some healthy eggs and is not yet ready to have a baby is a good candidate for egg freezing. However, it is imperative that they meet with a doctor to have a comprehensive assessment performed to ensure they are fully educated about the process and that it aligns with their ultimate goals. At Extend Fertility, a reproductive endocrinologist will evaluate a candidate's ovarian reserve, egg quantity, take into account her age and her fertility goals. and provide a personalized recommendation as to the benefits that egg freezing can realistically offer. For women 31 to 35 years old, 1 to 2 years of eggs, 12 to 24, is an optimal range, while 12 to 24 eggs may be sufficient in many cases. A cautious approach would be to aim for freezing 24 eggs or more. The most important factor is a woman's age at the time of freezing. But it is also vital to discuss AMH levels before freezing your eggs. AMH, or anti-Mullerian hormone, is a hormone produced by cells in the ovarian follicles. A higher AMH level generally means a higher ovarian reserve quantity, which tends to result in better responses to ovarian stimulation and more eggs retrieved. Once a woman's eggs are frozen, she can use them however she would like, if she'd like to switch them to an alternate facility. Extend fertility will ensure that is a smooth and efficient transition, though the key focus of Extend fertility is to center on the benefits of working with women to preserve their eggs in the present. We can also assist in advising how to utilize in the future, whether that be for personal use for additional pregnancy attempts or eventual donation for scientific research. If the patient decides they would like their eggs to be donated to another woman trying for a baby, that is possible. Keeping Up with the Kardashians airs on E! On Sundays at 9 p.m.